Happy New Year, viewers. Welcome to a program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children, with a view to provide lasting solutions. I remain your regular anchor, Shomowa Danis. You're welcome. Our focus today is on the sector review. I will start right away after the news segment.
One passenger, big auntie. Come enter my bus now.
Hey, conductor, this cough is serious. I beg, you need to go to the hospital.
Hospital? Auntie, if I go hospital now with this cough, those people will just say I have COVID-19.
No, they won't. Doctors say cough symptoms are different in every condition. Some are dry, others are wet, like your own.
God bless you, auntie. I have told this my conductor. The cough has refused to go, and it could be tuberculosis.
Conductor, check am o. Make you dey sure, because who no go, no.
Check that cough for tuberculosis.
Check am o, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
We understand that to improve the survival of breast cancer patients, we have to constantly keep up to date with the information being churned out by science and research. And so today we've gathered more than 60 cancer specialists from various parts of the country, majorly from southwest Nigeria, to sit together and just rub minds on how best to improve breast cancer care. Something that is critical to treating breast cancer patients is the decision we make in the clinic. We call it the multidisciplinary tumor board decision, where several doctors come together, think together, and review a particular case and make a decision. So the way of treating cancer, breast cancer, and other cancers in general is not just one doctor. It's a combination of different doctors who have different clinical expertise, who use the guidelines. And the guidelines are documents created for global use, and in those guidelines, we identify the characteristics of our patients and know the next steps we should take on how to care for them. So this gathering is cancer specialists, surgeons, pathologists, oncologists, nurses, and other cancer specialists who are coming together to learn, to share clinical resources and identify how to better treat and support our breast cancer patients.
Part of the essence of this symposium, as I was made to understand, was basically to leverage also on technology to improve access to cancer care. We all know that the cost of cancer treatment is so high, and we are improving and we are continuously trying to find ways to partner with government to bring the cancer care closer to the patient, to reduce the cost of cancer care as well. So we are partnering, oncology clinic is partnering with various community hospitals to bring the cancer care closer to the patient.
Treatment of cancer in Nigeria today is very challenging because, to start with, the prognosis or outcome of treatment is highly linked to the stage at which we start the treatment. And the knowledge of cancer, the awareness is not yet what it should be. So most of our patients present late. And for those who present early, there's paucity of facility for cancer treatment. They have to travel for over a long distance to reach facilities. Also, they pay out of pocket. This is a big challenge. Cancer treatment should be instituted in the NHI, in the insurance health system, so that they don't have to pay from the pocket, because cancer is about the most complex, condition to treat, and it's about the most expensive condition to treat.
Breast cancer is a heterogeneous disease. What does that mean? It's a disease that manifests in different ways in different patients. And so Mrs. A and Mrs. B can be said to have breast cancer, but they would manifest the disease in different ways, as well as benefit from different treatments due to their specific genetics, their genetic makeup. And so in this approach, it's very important to be able to carry out the correct tests for you to be able to group and identify these patients into their categories so that you can administer the treatments that will be beneficial to each of them.
We've been seeing quite a number of breast cancer cases. Either though we used to refer those cases out to either LASUTH, Ibadan or the rest. But with the coming of Pearl Oncology to the hospital and running a weekly clinic, that has helped localize treatment at Nigerian Navy Reference Hospital Ojo. And it has also helped reduce time on treatment.
When I was on my chemotherapy, Pearl Oncology, they came. They stand as if they knew me long ago. But God just showed them that, come and help this single mother. She needs help. And they assisted me. Since then, you can see me. If I tell you I have one breast, will you know? You will not know, because I want to live. We need financial assistance from the government, because many people that have this cancer, they don't have money to treat themselves.
While they get tested, we're reaching you from Pearl Oncology,
the heart of cancer care.
LASUTH, as we speak, is the preferred destination for a lot of people who have any emergency. We can conjecture from now till tomorrow why that is so. But we know that one of the major reasons is that people have a lot of confidence in the number of experts and the number of facilities that we have here. The cost of having care in private hospitals is astronomical, and a lot of people may not be able to go there. So they will come to a public hospital. As far as strategic staffing is concerned, let me boast a bit. We must be the only hospital in Nigeria that can boast of 5 neurosurgeons. Another exciting news, we became the first teaching hospital to have an accreditation for an emergency medicine department. What that means is that we will now be training emergency physicians. During the year, we renovated 12 private wards. We recognized that a lot more high net worth individuals needed our services, and they were asking for private wards. And we found that we saw that our private wards were not really up to the good standard we wanted. So we have now upgraded 12 wards to 7-star status. We carried out the installation of a brand new cold room in our kitchen. We bought utility vehicles. We were able to buy neurosurgical equipment. We were able to buy some heart surgery equipment in order to facilitate our open heart surgery program.
Comes up within the first 7 days of the new year. We want to keep them starting, get them prepared. That is why we gather them together here to refresh them. As the name goes, Fire Conference.
The Fire Conference is a gathering of ministers of the gospel to rekindle their spiritual temperature and brace up for the challenges ahead. The 2023 edition saw the ministers focusing on the state of the nation's health sector and predictions of more infectious diseases, calling on people to pay more attention to their well-being.
We have people with health challenges. We don't pay attention to our health in this part of the world. Why? It's because medical facilities, anything medical in Nigeria is very, very expensive. And our health sector is not doing well, so it's really affecting. If men of God breaking down, it's because they are not paying enough attention to their health, which I will advise: drink water, rest well, and eat good food. We have outbreaks in China and some part of the world, but in Nigeria it's well managed. Everything is fine, and we're praying that there wouldn't be further outbreaks in the name of Jesus Christ.
Your body, Bible says, is a temple of the Holy Spirit. So if your body is a carrier of something, and you take care of that body, whatever that is inside will be comfortable. When you are in pain, no matter how spiritual you may be, you will be down. So our bodies will be taken care of. Eat good food, exercise accordingly or appropriately. Do you understand? To keep fit.
They also spoke about the state of the nation and prayed for God's intervention in the forthcoming elections. Welcome back. We told you earlier on that our focus is on the sector review and to see how players can strategize to reform the sector in the new year. And the passage of the mental health bill a few days ago is a very good way to begin.
Dr. Moses Ani, an international health practitioner, says the grounds Nigeria, the so-called Big Brother, has lost to neighboring countries like Liberia, Ghana, and others, that it was once a shining example to, is lamentable. He blames the deterioration on the greed by those in position of authority who put public money to private use.
What should the authorities be doing outside when they have the wherewithal to build within?
If the country can actually work on improving the health sector, the health infrastructure, then that would help to lessen the medical doctors, the good doctors, the experienced ones leaving the country.
A close observation of the year under review also shows an upsurge in the mental health cases of many Nigerians and several others battling with suicide, stress, and depression, especially in cities like Lagos State.
A lot of people are displaced from their homes and their families. Apart from the fear you feel, the stress, the anxiety, then it can lead to some disturbances like insomnia.
The things that they take now, those things are making them worse. So you have a lot of mad people on the streets.
The malaria challenge, the outbreak of monkeypox, the yearly resurgence of Lassa fever, cholera, and Ebola in neighboring Uganda have remained points to strengthen interagency collaboration against emerging zoonotic diseases.
The biggest security threat we'll be facing in the 21st century will be caused by a biological pathogen or a biological agent that we know little or nothing about. And that is why it is very important for us to prepare.
One Health agenda. The One Health agenda speaks to the fact that we as human beings cannot be healthy if our environment is unhealthy or if the food that we eat is unhealthy. And so when we start thinking about health in Lagos State or anywhere else, we have to think of health holistically.
The renewed focus on primary health care, breakthrough in the monkeypox test kits by the Nigerian Institute of Medical Research, NIMA, the trial of new drugs for Lassa fever, the genome editing for healthcare and agricultural yields improvement were, however, some positive steps recorded in this sector.
With what we are doing today, any illness we have, we are going to crush it because we have all it takes here.
You go directly to the gene and modify what exactly is causing problem in terms of diseases, in terms of other aspects.
What we are doing today is looking at a particular drug that can be repurposed for the treatment of Lassa fever, so that we don't have just only ribavirin.
To strengthen medicine security with lessons from the COVID-19 pandemic, players in the pharmaceutical sector are concerned about collaboration with the petrochemical industries to advance local drug production.
We have to think of getting the petrochemical angle where we can get raw materials. Without raw materials, definitely there is problem.
With the alarming increase in non-communicable diseases accounting for over 24% of total deaths in Nigeria, according to the World Health Organization, WHO, there is a unanimous consent to enforce the National Health Insurance Authority to reduce the burden of out-of-pocket payment for healthcare services.
These diseases can be prevented and some can be managed. And with insurance, you are better placed to be able to manage those diseases.
The experts are advocating for improved budgetary allocation and budget performance to meet pressing financial obligations in the sector.
If you are just joining us, it's Health Affair on AIT, and next on the program is our nutrition segment.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week.
Eat healthy. Vegetables, fruits, keep off foods that have high salt intake, keep off pickled foods, food that contain nitrites and nitrosamines, e.g. processed meat and red meat. Keep off such foods, and eat healthy. Eat things like garlic, which is very good for the body. Eat broccoli. Broccoli is also very good for the body. Turmeric is also very good for the body. So red pepper. So those are very important things, foods that you should eat
We welcome your contributions on our perception segment on how to improve human lives in the nation's critical infrastructure. To be a part of this segment, please dial the numbers showing on your screen.
You know what happens when you go to public hospitals? You know the management, the treatment, the way you are taken. So why shouldn't governments say to themselves, we are spending 20% for the government-owned and spending 80% for the private practitioners? Rather, they will send their people for tax and so on to the private practitioners. And nobody goes to these public hospitals.
This is how we wrap it up today. Please join us same time next week for another interesting edition of the program. Please don't forget to advertise your health product and services on the platform. My name is Oshuomowa Daniels, and please keep staying safe.